But no, 2023, 20 years after the whole thing, we are getting the smoke. Come on, guys. In the recent NHS workforce plan, there were plans to increase the numbers of physician associates and also consider the introduction of a 4-year undergraduate medical model. Assuming this actually materializes, how will they distinguish between the physician associates doing the undergrad course and the doctors doing the undergrad? You are both doing 4 years. What are you going to take away from the PA curriculum to justify their existence? Whilst had you put that thing you've taken out of their curriculum in there, these people could have also become doctors and then they could have helped address the shortage. If you are going to make a 4-year medical school, the 4-year undergrad physician associate course should not exist. What? It defeats the whole purpose. And should that also become the case, the current misunderstanding back and forth between physician associates and doctors will be 10 times worse. At least currently the bros can tell us, listen, I spent 5 years in medical school and then I did my foundation, I did my specialty training. If you did 4 years and I did 4 years, on what grounds will you be making this argument? Then I would say it's just because I'm not allowed to do the foundation. It's just because I'm not allowed to do the specialty training. We are in for a surprise if things progress along. Hopefully it's just political points and there is nothing substantial, because if it becomes reality, we are in for a ride. If I say the 4-year undergrad course should not exist because it's a poor allocation of resources, then one could also make the argument that the physician associate course, even the masters, should not exist. We can allocate resources used to make these programs and then fund it towards the traditional medical route. It comes back to bite us. This whole thing is messed up. I told you, man, when you are trying to find the truth, you might sometimes find yourself at the wrong end of the stick. As you know, the GMC decides who is a doctor and who is not a doctor. Not because they design curriculums, but by making a list of outcomes that a given curriculum must meet. I had a chance and I tried to look at the proposed outcomes of physician associates according to the GMC, and I looked at what a doctor is according to these outcomes. And there I said the lines are blurred. When I was talking about this scope creep, if you allow physician associates to learn about endoscopy, we will want to do it. If you allow us to learn about interventional radiology, we will want to do it. As long as the avenues are there, physician associates will take it. But there must be a point at which we stop. If we keep taking it, we will indeed become doctors on the cheap. But we'll be doing everything these brothers are doing without being doctors. I just saw recently at Royal College of Physicians introducing guidelines on how physician associates are supposed to introduce themselves. Mr. too, I cannot call myself a Mr. Come on, man, Mr. I thought, Mr., once you come out of your mother's womb and you grow, you start getting some beard and some mustache, you're allowed to call yourself Mr. Not even that. Oh, but keep the faith. Hopefully everything ends up in the best possible way. All I'm saying is politicians make decisions. You can benefit from it, but it must be understood it's despite said decision not being for you. You might be the most convenient solution today. Tomorrow, who knows? It's your boy OT and I'm out. Salute.